We have a new development in the number of coronavirus deaths in this country. The total is now at 4, and all of them are concentrated in British Columbia. Susanna Da Silva is tracking what's happening from our Vancouver newsroom. So what's the latest, Susanna?
Yeah, 3 more deaths, and those coming from the Lynn Valley Care Home, the site of Canada's only other death. All residents who lived inside of that care home. We know that more than a dozen staff members there are also infected. It is a location they have been monitoring very closely, restricting residents. We've spoken to family members who have not been visiting their family who reside inside that care home. So now 3 more residents there have passed away. That brings in total, BC saw 30 new cases since yesterday, bringing the total up to 103 so far. 6 people in acute care in hospital right now, and 5 people have recovered, though they say there are others who have recovered but have not received the official testing to tell them that they have, in fact, completely recovered from that virus.
First, we need to ask you to ensure that if you or anyone in your household has one of those 2 symptoms, then you should stay at home for 14 days. That means that if possible, you should not go out, even to buy food or essentials, other than for exercise, and in that case, at a safe distance from others. If necessary, you should ask for help from others for your daily necessities. And if that is not possible, then you should do what you can to limit your social contact when you leave the house to get supplies. And even if you don't have symptoms, and if no one in your household has symptoms, there is more that we need you to do now. So, second, now is the time for everyone to stop non-essential contact with others and to stop all unnecessary travel.
The total number of coronavirus cases going up to 590 from 456 yesterday.
Yeah, it's a big rise. We had 456 yesterday, more cases today. The trajectory is carrying on very much the way the experts had predicted. Now, we've had a number of cases, a large spike, I believe, in Scotland. I'm just trying to find some more information about some information that's just been sent to me. But yes, certainly this is, it's a significant spike, but we can't exactly tell what those figures mean.
Ashish, we're just understanding that 2 more patients have died in UK hospitals from COVID-19. That's coming from NHS England. So that brings the total who have sadly died to 10.
To 10, yep.
Good evening. The death toll climbs every day by a little more, and so does the urgency around the question, how bad can it get? We've seen a leaked document warning that NHS staff that up to 80% of the population could be infected in the next 12 months, meaning up to 7.9 million people might need hospitalization. And even if we ramp up our hospital bed, nursing and ventilator capacity dramatically, how can the system cope? 35 people have now died in the UK, with a total of 1,372 positive tests, up from 1,140 at this point yesterday. The Health Secretary has said that over 70-year-olds will soon be asked to self-isolate for several months. 100 million Europeans are now under lockdown.
Yeah, at the moment, my daily work is changing continuously because right now I'm in an operating theater that we closed last week and transformed it into a COVID ICU. And this is the 2nd block out of 3 in my hospital. So now we have a general ICU that is clean with no COVID patient. But now we canceled all the elective and non-urgent surgery, and we are using 2 other theaters for COVID patients. So we are expecting a surge in the next days, and we all hope that this surge will not reach the intensity of Lombardy. We are probably 9 to 10 days behind Lombardy. And the intensity that this epidemic reached in the area around Milan was really hit very hard the healthcare system. So many hospitals are nearly collapsing, and the forecast for the next 10 to 15 days is even worse. So this situation changed completely our lives in little more than 1 week. We are working very hard with extraordinary efforts in order to increase our ICU capacity and hospital capacity, with also high dependency units working a lot in order to increase availability for patients. But we are not sure that will be enough. So my suggestion is that you get prepared as soon as you can, because once you start admitting severe ICU patients, it's probably too late for social distancing, isolation, and lockdowns.
Hey, what's up, guys? So look, this morning I got some test results back for coronavirus, and it came back positive. Yeah, and it sucks. Listen, I'm doing okay. Sabrina hasn't been tested, and she's doing okay. I didn't have any symptoms. I got tested because I realized I was exposed to someone who had also tested positive. I found out last Friday that they were tested positive. I quarantined myself and got a test immediately and got the results back today. Look, this is serious, you know? Now's the time to really think about social distancing, washing your hands. Beyond that, there are people out there who aren't showing symptoms and that can easily spread it, okay? So now's a real time to be really vigilant about washing your hands and keeping your distance.
Right, as we reported earlier, the president has put the entire Luzon under what the palace calls an enhanced community quarantine. We now have on the line Duterte spokesman Salvador Panelo to talk more about this. Mr. Secretary, thank you for taking our call. Welcome to the program.
Yes, Carmina.
All right, so let's talk about this. What exactly does an enhanced community quarantine mean?
It means absolute lockdown or total lockdown.
And when you say total, go ahead.
It means that all persons will be subjected to strict home quarantine with no movement and no transportation, except only for frontline health workers, authorized government officials, medical and for humanitarian reasons, as well as transport of basic services and necessities. Food and essential needs will be delivered in homes, care of the respective local government units. And there will be heightened presence of uniformed personnel in the quarantine area to ensure compliance.
En el día de hoy acabo de comunicar al jefe del Estado la celebración mañana de un Consejo de Ministros extraordinario para decretar el estado de alarma en todo nuestro país, en toda España, durante los próximos 15 días.
So what's your response to President Trump's travel ban, the main substance of his address last night?
I mean, I think it's, I think the U.S. travel bans are, wholly incoherent. There are actually 5 different policies that apply to different parts of the world. For example, you're banned from a highly functioning health system like, say, Switzerland, but you can come in if you're from a low-functioning health system like Russia or sub-Saharan Africa. But there's more than that. This doesn't make Americans safe at all. the epidemic here is just as bad, if not worse, than in most parts of Europe.
It's